All right, so I walk in the patient's room, I perform hand hygiene, provide privacy as needed. Hi, my name's Luke, I'll be your nurse today. Can you please provide your last name and date of birth?
Yes, Jones, 12/3/97.
Alrighty, and Courtney is going to be a, how old are you?
Well, I just said 97.
And that makes you how old?
27.
27, okay, so Courtney's a 27-year-old female who has just been admitted for a appendectomy. And I will be performing an head-to-toe assessment on her. So right off the bat, I'm assessing her level of consciousness. Courtney, do you know where you are right now?
Sanford, Maine.
Do you know what day of the week it is?
Thursday.
Yes. Do you know who the president is?
Donald Trump.
And what year is it?
25.
Okay, perfect. Do you know who I am?
You're Luke.
And what building are we in right now?
The York Hospital / Maine Health
Oh
Walk-in.
my gosh, perfect. Okay, so then I'm also going to assess right now her like facial symmetry. So Courtney, can you go ahead and
Some Botox.
I know, Courtney, can you go ahead and make a big smile for me? Awesome. Not noticing any facial drooping when I'm talking to her, any slurred speech, her mouth drooping to one side or the other. I'm also going to note any mobility aids that she might be using. So if she's using a wheelchair or a walker or crutches or things like that, if she has any prosthetics. I'm also going to obtain her vitals at this point, make sure that those are all within normal limits and notify the provider if they are not. I'm going to ask her, Courtney, are you in any pain today?
No.
No, you're not? Oh, that's awesome for an appendectomy. I love that. Okay, well,
Am I posted?
there's a first patient for everything. So Courtney is at a 0 out of 10 pain scale. I'm also going to note her skin color. Is she jaundiced? Is there any sort of flushing, redness? Courtney looks great as always. And then I'm going to move from head to toe. So I'm first going to palpate her skull. Well, you got a full noggin. Looks good. Go ahead and look forward for me.
Like
Awesome. Yep. And then right now I'm just feeling her skull. Any signs of movement? There's none. I'm also going to check for any infestations. You can look up, Courtney. There's no infestations. I don't see any lice. Thank God.
Oh God.
And the next part, I'm going to be examining her eyeballs. So take a seat next to my patient to make them more comfortable. So I'm going to take a look at her eyelids. I'll pull up on her eyelid and then going to pull down, inspect her the conjunctiva, make sure there's no bulbar conjunctiva, I think that's what it's called. And then I'm gonna ask Courtney to look at my finger for me. Good job. It's gonna be a little bright light. Just look straight ahead. Checking her pupillary response, making sure her pupils are equal and reactive to light. I'm gonna ask Courtney to go ahead and follow my finger. Perfect. Perfect. Then one more time. Red reflex in both eyes. Good job. And then I'm going to test all 6 fields of cardinal vision. So 1, 2, 3, 4, 5, 6. Okay, perfect. I'm then going to move on to ENT. So I'm going to first, since we're already at the head, look at Courtney's brows. Is there any hair displacement? Did that with her head as well. I'm then going to palpate her sinuses. Are you experiencing any pain, Courtney?
No.
Okay, perfect. I'm then going to ask her to do a scent test. This is some coffee.
Smells like coffee.
Perfect. That's also a cranial nerve test. I am then going to use my pen light once again. Check for any septum deviation. Courtney looks great. Inspecting her nares for nasal mucosa, if there's any abnormal drainage, any foreign bodies. I'm then going to ask Courtney to open her mouth for me. Awesome. Inspecting her teeth, her tongue, and then go ahead and say ah for me. Stick your tongue out. Awesome. Her uvula does move. That's always a good sign. And then go ahead and just stick your tongue out for me. Perfect. See if there's any sort. Make sure her tongue is midline, doesn't deviate from one side to the other. And then Courtney, I'm going to ask you to say light, tight, and dynamite.
Light, tight, and dynamite.
Courtney is okay so far. So then I'm going to go ahead and take my otoscope. Yes, okay, that is the term. And then I'm going to pull back on her ear, making sure I can see the tympanic membrane No signs of erythema, excessive cerumen, any signs of impaction. Courtney looks great. Courtney, are you having any problems with your hearing?
None.
No, any ringing in your ears?
Nope.
Okay, so go ahead and look straight forward for me, Courtney. Let me know if you hear this. Which side did I just whisper on?
My right.
Perfect.
I can't see you.
Ready?
Hello. My left.
Okay, perfect. And then I'm going to move on to Courtney's neck now that we've done her head and her eyes and her ears, her nose, and her throat. So Courtney, go ahead and look up for me. I'm going to feel down Courtney's trachea, any signs of tracheal deviation. I'm going to also ask her to go ahead and turn your head all the way towards me. Nope, other hand. Yep. Next side. Yep. Do you have full mobility of your neck, Courtney? Can you roll it all around like that? Perfect. I'm then going to take my pen light once again. Can you go ahead and tilt your head all the way this way? Look up a little bit. Perfect. Examine for JVD, jugular vein distension. Can you then swallow for me, Courtney? Any difficulty swallowing? No? Perfect. All right, we're then gonna move on to her respiratory examination. Gonna count Courtney's respirations. I would not make this obvious because she would probably try to breathe differently. Make sure her respirations are within normal limits. I would then ask Courtney, do you wear oxygen?
I do not.
Do you ever wear oxygen?
Never have.
Perfect. I would then, we are not going to do this. I would then examine Courtney's thorax for any signs of barrel chestedness or abnormalities. I would then palpate her chest, feeling her rib cage, making sure I'm feeling no crepitus or any movement within her rib cage or her bones there. I would then auscultate her lung sounds. We'll start on the back. Courtney, go ahead and take a breath for me. Perfect. And then I would zigzag my pattern to all 6 fields, asking her to take a breath with each. Perfect. And then perform a breast exam if needed. We would then move on to our cardiac assessment. I would obtain her blood pressure, ask if she has hypertension or any pre-existing conditions. Courtney, are you having chest pain?
No.
Do you have shortness of breath?
Nope.
No. I would then test her capillary refill. Perfect. Patient does not have nails painted. I would then take her carotid pulse. Okay, and then I would feel them at the both at the same time to test for symmetry. You're symmetrical, congratulations. I would then take the bell of my stethoscope and not hit her.
You didn't. Cleared.
Yes, and I will auscultate for bruits. I do not hear any bruits, that is good. I would then keep my stethoscope on, and I will auscultate her heart sounds over each valve, and then apical pulse for 30 seconds, or if abnormal for 1 whole minute. And then just checking the 5 cardiac landmarks. I would then assess Courtney. I could right now for any signs of peripheral edema, any signs of CHF or heart failure, but yeah, that's pretty much it. I will then move on to the abdomen. Courtney?
Do you want me to lay down?
No,
Oh,
you
okay.
can stay right here.
Okay.
Are you having any abdominal pain?
Yeah, I will.
Oh, right. Okay,
Because I
that's
had
changed. Appendectomy, correct.
I forgot about that.
Right. So, are your BMs in check? Have you been pooping good?
Yeah, Metamucil.
Yep. No diarrhea. No constipation.
No.
Okay, that's perfect. I would then examine first her abdomen, look for any signs of distension, any lumps, bumps, things like that that wouldn't be normal. I will then auscultate the 4 belly quadrants, listening to her bowel sounds, noting for signs of a hyperactive or hypoactive bowel. If so, taking a longer time to auscultate if abnormal. But you are gurgling, Courtney. Congratulations.
Thank you.
I will then move on to palpation. I will first start with a surface level. Any pain?
Nope. Not when you're pushing.
None at all, even right there is your appendix?
Yeah.
Okay. I will then move on to a deep palpation. Oh, you feel it now? Okay, perfect.
Yeah, deep a little bit.
Perfect. All right. I will then put my stethoscope back on with the bell. Abdominal aorta. I hear it. Doing good. I will then check for any signs of an inguinal hernia down here. And then I will go ahead and ask you to stand up for me, Courtney. Perfect. I'm then going to test for CVA tenderness by knocking on her back. Does that hurt?
No.
Perfect. Awesome. And go ahead and sit down. And then, if appropriate, perform a male or female genital exam. Then going to move on to the neurological portion of the head to toe assessment. Courtney, what did you have for breakfast this morning?
Banana muffins.
Okay, perfect. What were you doing on Saturday?
I think I was working.
Okay, perfect.
I think.
And where did you go to elementary school?
Cardio in.
Okay, perfect. I will then go ahead and assess Courtney's sensation, touch and sensation. So, Courtney, will you... She would be barefoot.
Oh, God.
Can I pull this up from under you, please?
Oh, yeah. Needle?
Perfect, yes. Go ahead and look all the way that way. No, this isn't a needle.
Oh.
It's monofilament. It's diabetic. Okay. Are you diabetic? Okay. Go ahead and look all the way out. Wait for me. All right,
Yeah.
just say yes when you feel me touch.
Yes. 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 There's a lot of yeses. Yes.
Okay,
I
perfect.
felt that all.
That is, well, that was the light sensation. I will then go ahead, let's see. I don't have anything to test that with, but I would test her sensation to both sharp and dull feelings, sensations. I would also test for vibration, and hopefully Courtney passes all of that.
Yeah.
Perfect. All right, I'm gonna remove this from under you. We're then gonna move on to musculoskeletal. So I already have done her neck up, but I'm just going to go ahead and take your arms here, Courtney. Can you do this?
I can.
Perfect. Does that hurt?
No.
Okay, perfect. I'm also feeling for muscle tone. And I'm gonna, muscle tone is popping. Good job, Courtney, hitting the weights. All right, can you go ahead and put your arm all the way behind your back for me? Perfect. Can you go ahead and put your other arm all the way behind your back for me? Also perfect. Can you go ahead and lift your leg up for me? Awesome. Lift down, leg up, down, extend. Other side. Perfect. Alrighty. Can you wiggle your wrists around? Perfect. Can you push up for me? Push down. Perfect. Wiggle all your fingers. Awesome. Can check for capillary refill here as well. Awesome. And then same deal. Can you roll all your ankles around for me? Perfect. Wiggle all your toes. Push up. Push down. Perfect. All right. Go ahead and stand up for me, Courtney. I would then also feel down my patient's spine. Make sure there's no signs of curvature, abnormalities. There is not. You can go ahead and have a seat for me, Courtney. So yeah, noting, I would then feel down her legs, noting any signs of, noting her muscle tone, any signs of atrophy. I would then could also, at this point when I'm doing her legs and her arms, take her radial pulses. Perfect. Pedal pulses. Perfect. Noting her hair distribution on her legs. Shaved. I could also check for edema at this point as well. And then I'm going to go ahead and ask you to stand up for me, Courtney. Go ahead and walk all the way over to that side of the room. Can you walk in a straight line?
And heel toe?
Nope, just...
Oh.
Not a DUI. Go ahead and turn around for me and go ahead and walk straight ahead. Perfect. And then if you could at this point, can you walk on your tiptoes? Same way, front and back. Perfect. Okay. Awesome. Next, looking for, any signs of abnormal gait, inability to balance. Perfect. And walk on your heels. You got it.
More painful.
Okay, and next side. Perfect. All right. I will then perform the Romberg test. So Courtney, come stand right in front of me. Perfect. Go ahead and just hold your arms out by your side like this. Checking for sway. Close your eyes, sorry. Courtney's not swaying, she's fine. And I perform that for the appropriate amount of time. Then ask Courtney, do you have any other questions for me?
I think we're good.
No, that's good, awesome. I will then document this appropriately and report to the provider. Thanks, Courtney.
Good job, Blue.
Yes.